My name is Rachel Smith. I'm Embryology Innovation and AI Lead at Care Fertility, and I'm here to talk to you a little bit about our experience with ambient humidity and the possible effects it may have on your embryology and clinical outcomes. So Care is one of the largest fertility providers in the UK. We've also recently expanded internationally to Spain and to the US, and we have over 25 years of experience in this sector. So when we're talking about osmolality, this starts with the culture medium, and all culture media is prepared with a range of osmolality, and within that range, you would assume embryo quality and development would be as normal, but outside of that range, we can impair embryo development. So what affects osmolality within our laboratories? Well, there's three areas. The first is dish preparation, where the effects of temperature, the size of the volumes we use to culture our embryos in, and also the airflow of our labs and our flow cabinets can affect evaporation. The other areas that can affect evaporation is our incubator choice, whether it's humidified or dry. This can affect the evaporation rates. And the other area, which is where we're going to look at today in the main, is environmental humidity. Changes in humidity within our labs, maybe seasonally with the use of air conditioning, and also in the way we culture. Are we using a one-step approach, or are we preparing a sequential media to support our embryos with a dish change? All of these factors have a play with osmolality. So we'll first focus on dish preparation. Here you can see a practitioner preparing one of our dishes. And before the oil is overlain on the dish, there is the possibility of evaporation. And this can happen with increases of temperature and airflow. So what can we do to prevent that evaporation at this point? Well, we can prepare our dishes on a cool surface. We can take that media directly from the fridge. We can try and reduce the airflow within the environment where we're producing or preparing the dishes. And we can do this quickly and methodically and overlay the oil as quickly as possible to provide that protective barrier. So when we're looking at the incubators, these can also have a bearing on evaporation rates. We culture our embryos at 37 degrees, and within this time there can be evaporation within the of the culture media. So many labs use a non-humidified incubator system. And does this affect the osmolality when we're culturing embryos for a significant proportion of time, say over 5 or 6 days, in a humid versus a dry environment? Well, Megan Lockwood, who is one of our lovely embryologists at Care, did look at this and was presented her findings at Fertility 2022 on the difference in the change in osmolality over days when you're looking at a humidified system like the Jerry versus a non-humidified or a dry system like the EmbryoScope. All the dishes were produced with the same media, with the same starting osmolality of 270. We prepared the dishes in the same way, and then we cultured them in these different incubators at the same time to assess the evaporation. So they had the same exposure of environmental conditions. And here you can see that the Jerry didn't change very much in its osmolality, very close to the starting osmolality, whereas the EmbryoScope dish had a very different picture. Over time, this lost more because it was potentially in a dry environment. But within all of these experiments that we did comparing these two different culture conditions and dishes, at no point did the osmolality increase to a range that would be outside of expected normal range for embryo development. So we can look at some of the publications. Here I've focused on one by Varzi and his team back in 2017. This compared culture over 5 to 6 days. They had no media change on day 3, and it reviewed using a randomized controlled trial culture in a humid versus a dry incubator. And these were the results. There was increased blastocyst formation, increased blastocysts that were frozen, and an increase in clinical pregnancy rate when you were comparing a humid environment to a dry environment. At no point did they acknowledge the ambient environmental conditions to know what sort of level of humidity the dishes were exposed to, and they didn't perform a media change as part of this experiment. So when we are looking at ambient humidity in our labs, what do we look for? Well, there's very good guidance out there from the health and safety executive within our governmental rules for working practices. And in these, it states that anything lower than 20% may be considered low humidity, which for a worker would cause, dry eyes. So we've used this as a cutoff to consider when an environment would be considered low. So we've started to record at Care the background humidity so that we can identify when it drops to a very low level. And we noticed that in one of our clinics, this was often prolonged and it happened more frequently. So one of our embryologists, Alina Young, did look at this in more detail to look at the differences perhaps in the clinical outcomes when we were looking at these low background humidity levels. So she looked at the incubator type. We had 2 that were dry, which was the embryoscope, and we had 2 that were humid, which was the Jerry and the planer system. We acknowledged that there was a cutoff between those running any, if they had 20% or less in that culture period versus culture at an acceptable level. And we did immediately find a difference in utilization. So blastocyst utilization was a lot less in the low background humidity. So this forced us to make a very rapid change in our practice because we wanted to understand how we could repair the humidity levels and the possible evaporation and causal effect on osmolality back to a normal level for our patients. So by doing a dish change on day 3, we felt that this would overcome the length of time that the dish has in culture and is exposed to those high temperatures and would therefore reset the osmolality halfway through the embryo culture. And this is what we instigated. And this therefore allowed us to review and see that by performing this action when the humidity was very low, we could then increase the utilization rate back to within an acceptable level and not significantly different from the humidified. And we could also look at the clinical pregnancy rate and see that that was comparable for these patients as well. When we did the same for all patients to see if a benefit would be done in the dry incubator with a dish change when the levels of background humidity were normal, we found that it had no effect. If anything, we saw a clinical pregnancy rate that was lower in this patient subgroup. So we decided that there was no advantage to do a dish change if the environmental conditions were normal. So in summary, we would advocate that monitoring your humidity levels in your laboratory environment is essential to be able to understand changes over seasons and in certain circumstances where an action might be required to ensure that the osmolality in your culture media is maintained over the course of your embryo culture. Acceptable background humidity in a dry environment for incubation would suggest that a dish change is unnecessary. But if your humidity levels drop to a low level, then you would benefit from instigating a day 3 dish change. And what we do know from all of these experiments is that humidified incubators do protect against some of these variations in evaporation rates by providing a humid environment. So if the humidity does drop, there is a protected effect of utilizing a humidified incubator environment. Thank you very much for listening to my talk. And if you would like any further information, then I'm happy for you to contact me through Genea. Thank you. Bye-bye.